Welcome back. I'm so excited that you're joining me again because we're going to be continuing our conversation all about menopause. And if you're joining me for the first time, my name is Dr. Ivy Branin. I'm a naturopathic doctor based in New York City, though I see patients all over the states and all over the world. If you like this video, don't forget to like it. And of course, I highly encourage you to subscribe to my YouTube channel because I would hate for you to miss any of the great and exciting content I'll be putting out specifically on menopause. So we're continuing our conversation from my last video on menopause, and we're going to talk all about what is menopause, what are some of the symptoms, and what can we be doing about it. So first off, what is menopause? So a very basic definition of menopause is once a woman has stopped menstruating for over a year, she's technically in menopause. Though I always think it's funny that we call it menopause when it's really meno-stop, meaning menstruation has stopped. Why has menstruation stopped when a woman hits typically her mid-40s to early 50s? It's because she stops ovulating. And when you stop ovulating, well, the reason you stop ovulating is that the body no longer needs to get pregnant, and that ovarian reserve, which is the amount of eggs that you have, has greatly diminished. For like a little bit of refresher on how the menstrual cycle works, because I feel like it will kind of explain some of the symptoms that women experience when they're going through menopause. Though I like to kind of sometimes be really more accurate, that when women are having these symptoms, it's actually more characteristic of the perimenopausal phase, so actually before menstruation has stopped completely. So the key hormones that we think of, the main two are estrogen and progesterone, which are hormones that most of you might be familiar with, and then two ancillary hormones, FSH, follicle stimulating hormone, and LH, luteinizing hormone. So we look at the first part of the cycle, which is what we call the follicular phase. First, estrogen, the production of estrogen dramatically increases, and that's going to do one thing. It's going to help to build up the uterine lining, which will eventually help to support a pregnancy. But also this uptick in estrogen causes LH, luteinizing hormone, to surge. And when it surges, then we have ovulation. When ovulation occurs, we go into the luteal phase, and progesterone kicks up and becomes more of the dominating hormone, and that's to support the pregnancy. And of course, if a pregnancy doesn't happen, then we have menstruation. And the reason that we have menstruation or that monthly bleed is because of the decrease in hormones. So it's just kind of like an idea of what a normal menstrual cycle is. And one of the things I like to think about with menopause is that though you still have estrogen, progesterone, they're more in the resting phase right before the buildup. So kind of just like a recap, one of the key markers that a woman is in menopause is FSH and LH are very, very high. And then other hormones, estrogen, progesterone, are very, very low. So what are some of, and then just one little thing about that. So we actually produce estrogen, progesterone, and also testosterone, not just in our ovaries, but we also produce them in our adrenal glands. So another kind of key distinction between menopause and premenopause is that our adrenal glands become the primary producers of these hormones. So that's just a little bit of a recap. So what are the main symptoms of menopause? So probably the most classic is night sweats and hot flashes. Of course, also specifically when you're in that perimenopausal phase, you're gonna see changes in the menstrual cycle. So whether it's long periods of time without a period or more frequent periods, in fact, even longer prolonged bleeding. I've seen many women in the perimenopausal phase actually have periods of a month-long duration. And a lot of this actually has to do with the drop in progesterone, which tends to be the first hormone that kind of gets knocked out. And that's one of the reasons for these heavier periods. Vaginal symptoms, so pain, more vaginal dryness, tenderness, specifically pain with intercourse, sleep disturbances, partly to do with the hot flashes, but also both progesterone and estrogen do impact melatonin. And as we know, melatonin is very much associated with sleep. There's also psychological symptoms, things like depression, anxiety, moodiness. We can also see changes in weight. There can also be difficulty with memory and concentration. We'll also see skin changes, mostly due to the decline in collagen. So you're going to see an increase in dryness, an increase in wrinkles. And lastly, there can be also hair changes, so loss in hair. And then, one of the things I forgot to mention specifically when it comes to skin changes, that actually some women going through menopause can actually have an increase in acne and also facial hair. And I'll talk a little bit more about that later. So what are some of the ways that you can deal with the symptoms of menopause naturally? So first, one of the most important things for women going through menopause is exercise. So exercise is going to do a lot of things. One, it is going to help with mood. It is also going to help prevent weight gain. It's also going to really support sexual function. One, because it does have an impact on testosterone and oxytocin. It's also going to help to strengthen the pelvic floor and also help with circulation. Now, a couple things about exercise: definitely weight bearing and weight training, strength training, and resistance training, all really important for building up muscle mass. So as we age, we lose lean muscle mass, and lean muscle mass is what helps us maintain a healthy weight. Also, though yes, doing some cardiovascular exercise is important, we want to be careful about cortisol, and so not doing too much very stressful exercises, because one of the downsides is as estrogen and progesterone decline, we end up actually having more of the negative side effects of too much cortisol release. So you have to be careful when it comes to exercise and cortisol. Mindfulness techniques and stress reduction, very, very important. Actually, studies have shown that women who have a better outlook, specifically when it comes to menopause, tend to have less symptoms of menopause. And then, like, when I think about some of the basics of supplementation, so having a really good multivitamin that has methylated B vitamins, specifically B12, as studies have shown, deficiencies in B12 actually increase hot flashes. Other key nutrients to look for, specifically when you're looking at a multi, would also be vitamin E, C, D, all very, very important for helping with menopausal symptoms. Also magnesium, and then a high quality fish oil. Not only is that can bring down inflammation, but then also one of the, it's not really a symptom per se of menopause, but after menopause, there's definitely increased risk of cardiovascular disease. And so having a good quality fish oil is very, very helpful. Plus also its effect on mood. The next definitely, and I feel like I'm always talking about this, but I can't overemphasize this enough, a probiotic, specifically one that has Lactobacillus rhamnosus and Lactobacillus reuteri. I mentioned this one in my YouTube about urinary tract infections, but it's very important for women who are going through menopause because as we age and estrogen declines, this actually has an impact on our vaginal flora. Our vaginal flora is some of our best defenses against urinary tract infections and bacterial vaginosis, which actually increases when you've gone through menopause. So then if we're looking at specific symptoms, so hot flashes, my two favorite hot flash herbs are maca and rheum. Specifically maca though. Maca I have actually seen as a singular, and if you've watched some of my videos, I typically usually recommend a combination of herbs, but maca on its own, specifically the gelatinized form, is so effective against hot flashes, plus a lot of the other issues that women face when they're going through menopause. So it really helps with definitely the hot flashes, but it also helps with some of the other symptoms that I'll also talk about. Rheum, also known as Turkey rhubarb, also very, very effective for hot flashes, and often I'll use them together. Libido. So again, there can definitely be a dip in libido as we are going through menopause. So maca, really good for libido, but also a lot of our adaptogens. And so adaptogens are those that affect or tonify the adrenal glands. And as I mentioned earlier, that it's the adrenal glands that take over when we're going through menopause. And there's some specific adaptogens that have an effect on testosterone. And so this can be really effective when it comes to libido. So ashwagandha is probably one of my favorites, specifically because it also has benefit in sleep. And then the other is ginseng, so specifically Korean ginseng. And then from a nutrient, L-arginine can really be effective for helping enhance libido. Lastly, looking at other factors, vaginal dryness and irritation. So as I already mentioned before, probiotics, definitely very helpful, but one of my favorites is actually vitamin E suppositories. These can be really, really helpful in soothing tissues, in helping to counteract any dryness, and then also looking for preparations that contain hyaluronic acid, and basically hyaluronic acid helps to lock in moisture. So you might be wondering, how long does menopause last? Well, short answer, literally forever. Once you're in menopause, you're in menopause for life. Now, often when we think about menopause, what we're really thinking about is the symptoms. And really, I'd say, like anything else, it really, really depends. But the average woman will experience symptoms of menopause for at least 4 to 5 years. And I think also we often think about the main, again, symptom at being hot flashes and a lot of the mood changes. These are typically more short-lived, though there are definitely symptoms that will persist. Vaginal dryness and thinning, also some of the hair changes that women may experience during menopause. So you might be wondering, okay, great, so how can working with a naturopath help me through menopause? So it's definitely a couple things, definitely guiding patients through healthy diet and lifestyle choices. Specifically, again, a lot of things change as we age. Another thing that I mentioned earlier is that, again, because our adrenal glands are going to be the primary producers of our hormones once we hit menopause, every woman is going to be a little bit different when it comes to her ratio of progesterone, estrogen, testosterone, and then also DHEA. So one of the best ways to kind of see a predictor prior to menopause and then once you're in menopause is running a Dutch test, because then also, in addition to looking at those hormones and their metabolites, we can also look at stress hormones, neurotransmitters, and helping to bring them more into balance so that you can go through menopause with more ease and grace. So that's a lot, and hopefully you enjoyed this video. And again, definitely want to subscribe to my YouTube channel because a lot of exciting content is coming out. Specifically following this video, I'm actually gonna have a whole video all on menopause and sex. So it should be really, really exciting. And also, if you like this video, don't forget to like it. Again, my name is Dr. Ivy Branin. I'm a naturopathic doctor, and looking forward to seeing you next time. Have a great day.